When should you use recovery position during a stroke? Imagine seeing someone suddenly collapse or become unresponsive. You might wonder what to do next, especially if they seem to be breathing but are not fully conscious. In first aid for stroke situations, knowing when to use the recovery position can be life-saving. The recovery position is a way to help keep the airway open and prevent choking, but it's only appropriate under specific conditions. If the person is unconscious but still breathing normally and has a clear or partially clear airway, placing them in the recovery position is recommended. This involves gently rolling them onto their side, with their head tilted slightly forward. This position helps fluids like saliva or vomit drain out of the mouth, reducing the risk of choking or aspiration. It also prevents the tongue from blocking the airway, which can happen if the person is lying flat on their back. However, it's important to remember that the recovery position is not a treatment for stroke. It is a supportive first aid measure to protect the person while waiting for emergency medical services to arrive. If the person is unresponsive and not breathing normally, such as gasping or showing signs of agonal breathing, you should not place them in the recovery position. Instead, immediate CPR and emergency interventions are necessary. Use the recovery position only if the person is unconscious but breathing normally and there are no signs of spinal injury. If you suspect a spinal injury, do not move the person unless absolutely necessary, and call emergency services for guidance. When placing someone in the recovery position, make sure their head is tilted slightly forward, their mouth is accessible for fluids to drain, and their body is stable. While waiting for help, continuously monitor their breathing and responsiveness. If their condition worsens or they stop breathing, be prepared to start CPR. Always call emergency services immediately if you suspect a stroke. Remember, first aid measures like the recovery position are supportive steps and do not replace professional medical treatment. In summary, the recovery position during a stroke is used only when the person is unconscious but breathing normally. It helps keep the airway open and prevents choking while emergency medical help is on the way. Always seek professional medical care as quickly as possible, because stroke requires urgent evaluation and treatment.